For joining us on the news at 7. We are staying with the development on the protest by nurses and midwives who are threatening to shut down Nigeria's health sector in 48 hours. But that if the Nursing and Midwifery Council of Nigeria refuses to withdraw the new guidelines for verification of certificates. The nurses want the council to address the shortage of nursing staff in hospitals, salary scale, and nurses' welfare, instead of attempting to limit the career opportunities for nurses. Sarah Ayeku reports. For more on this protest by the nurses, I'm being joined by Catherine Kuyoro, who is a nurse, and she joins us from the United Kingdom. Thank you for joining us on the news at 7. Help us better understand the grievances, the petition really of the nurses.
Thank you very much. Thank you for this opportunity. I would like to say that nurses are disappointed. We are hot. This has come really shocking because the whole issue about the verification started from December, and we did not understand why it was removed from the online portal, because usually you are able to just verify yourself online by applying. And just this February, we just got a circular saying that you need to have worked for 2 years, you need to wait for 6 months, something that was taken just 2-3 weeks before. We need to wait for 6 months, and also you need to get letters from your CEO, you need to get a letter from this place, and it's all just crazy to me. Because if you need to just be verified, for you to be verified, you have to do all of that. Are they thinking of the patient these people are taking care of? How can an employer verify that this nurse that is taking care of this patient, the lives are put in charge of this patient, or the lives are put in charge of this nurse? How am I going to be able to be sure that the nurse is a valid nurse? This nurse is actually a registered nurse. Verification is simple. We just want to be verified. Anybody can be verified for as far as you're a registered nurse. And it doesn't even have to do about migration or anything. Any institution, anybody can decide to say, this person I've employed, I need to verify that this nurse is valid. So imagine you working for 2 years before anybody can actually verify that you're a registered nurse.
All right.
Where does that?
All right. You're talking to us from the UK, Nurse Catherine. And do you consider that this might just be an initiative of the Midwifery Council to contain the spate of migration, brain drain from Nigeria's health sector? Possibly, because I cannot be too sure that that's what they are trying to do. But if it is, to me, it's a failed attempt, honestly, because Nigeria do not have shortage of nurses. We actually have too much. You think we have too many nurses in Nigeria?
Yes, we have too much of nurses who are unemployed. A lot of nurses. I'm telling you, if you put out an application now and say, oh, you're recruiting nurses, you will be overwhelmed with the numbers of applications you will get. There are too many nurses. I currently have a group of nurses of about 1,000 nurses on that WhatsApp platform. And if you post a job, you need to see how many people are trying to get a job. There are people not working. If you look at the government is also not employing. I worked at the time at Ibadan North Local Inc., and I could tell you confidently that we didn't even have up to 20 nurses working in that local government. Now we have vacant roles that are supposed to be filled by nurses, by CHILs, community health extension workers, just because they do not want to employ nurses and they do not want to pay. So
thank you. Yes, thank you very much, Nurse Catherine, for sharing your thoughts with us. We'd have to take the conversation further, hear from the Midwifery Council and see what really is going on and how to improve our healthcare system. Catherine Kuyoro is a nurse and joined us from the UK. Thank you.
Thank you very much.